Welcome to Caffeine, Chaos, and Critters. My name's Justin, and I'm drinking a lavender oat milk latte matcha, I guess. I feel like I always sound so unsure of my beverage. It's because I make it from home, so I don't really have a name for what it is, you know?
Valid. My name is Kaitlin, and I'm drinking the same thing. I would just call it a lavender matcha latte.
That's a better name, honestly.
Dairy-free.
Well, mine does have regular milk in it, too.
Mine doesn't.
Well, not all of us have dairy issues, okay?
Fair enough. Well, first of all, I just wanted to say happy holidays. This episode will release, I think,
The Monday after Christmas.
Monday after Christmas, which means y'all will experience Christmas before you see this, but I hope you all had a wonderful Christmas, and I hope you all have a happy New Year as well. This week, we still don't have a listener story. Reminder that our email address is vetmedpodcast@gmail.com. So please send us your stories, questions, or just something interesting. If there's like an interesting study that you recently found, or you're in tech school or vet school and you learned something amazing that you want people to know about, please send that to us so that we can talk about it on the podcast. We would love to hear more. That being said, we've decided to replace the listener story segment with a veterinary news segment until you guys can give us something. But that being said, I had a couple of things that are just relevant, at least relevant to me. I don't know if they're relevant to everybody, but relevant to me, and they are veterinary world related. So yeah, Justin, if you don't have anything to add, I think I'll just dive into them.
Yeah, all I have to add is I hope all of you ER technicians didn't have too many Christmas euthanasias, because that's just a thing.
Yeah. I'm not missing that right now. I'm not missing that at all.
I went out with some friends and mentioned that Christmas Day is just euthanasia day at the ER.
Yeah.
And people are just shocked that they would bring their pets in to euthanize on Christmas Day. Which, for those of you who don't work in ER, it's quite literally Christmas Day is just back-to-back euthanasias typically. Because, families are together for the holidays and their family dog Molly is 20 years old today and it's just not been doing well at home, and they wanted the whole family together for the euthanasia, so they bring them in on Christmas after they've opened all their presents. I actually have an experience with a patient that was hospitalized that was not in the best shape, but it was the end of December, and the owners were just I just really want them to make it to 2025. And so they tried to keep the pet alive until January 1st so that they could euthanize it in the next year. They wanted it to finish out the year of 2024.
I don't really understand that, but everybody has their own way of dealing with that. I know it's hard and I know it's stressful, so I can't pretend to know what other people go through with their pets, but
sometimes it's hard to make sense of other people's opinions and views, but you just gotta try your best.
Yeah. I mean, it is a rough time of year though, so definitely if you are in the veterinary field, if you are an emergency and you are experiencing a lot of loss at work, just know that your job is important and
you're not alone.
Please make time for yourself and spend time with your family as well. I don't know. I guess I don't really have good advice for that because it's hard for all of us. But yeah, you're not alone. So
there's people all over the world dealing with that too, working in clinics.
True. Very true. All right. Well, in veterinary news. So the first thing I wanted to talk about is the fact that NAVLE is being audited. So they've been under a lot of flack recently. I guess because there was word out there that the exam itself was not a fair assessment of like a candidate's knowledge. I don't know like the full details of that. However, I've seen lots of videos on TikTok and Instagram about people just kind of hating on the exam in general, and also saying that communities that are less privileged, so to speak, are again not being fairly assessed with this exam. So that was part of it. Like so many differing opinions on the internet about it that they decided to go ahead and just do an audit. So they're doing an independent audit and they are not releasing any other information as of right now. So all we know is that they're doing their own audit. We don't really know what that entails. We don't really know what's going to come of it. We don't know if the exam itself is going to change, if they're going to change the exam process. Obviously, that's something that I would like to know more about, considering I have to take this exam. So, which is crazy to say. But
It is so crazy.
but hopefully the audit demonstrates positive change, I guess. Hopefully that's what comes from it and they can ease people's minds a little bit that they are being fair. I don't know. Like I said, they just are not giving a ton of information from like their side. If you go to their website, they have like released a very short statement about it saying like they're aware of how people feel about the exam process and they're working on making sure that it is truly fair. So that's the update. Obviously, if they do the audit and something comes from that, I will happily talk about it on this podcast. So if you keep watching our podcast, I will update you with that as soon as we know. But we'll see what comes from the
Interesting.
audit. And I guess if something is messed up or the assessment is not fair, hopefully they make some changes for students in the future. Yeah. So that's about all I know. The other thing that I wanted to bring up was I was scrolling through the AVMA website and kind of just looking at what they have right now. And we have done an episode on like technicians, leveling up technicians and utilizing them more in the field, and also kind of our thoughts on like a PA sort of position within the veterinary world, because Colorado State University is actually starting a program for that. AVMA has been against it, as far as I know, from the beginning, and I think we talked about that last time. But they released a new article from the board of directors, Dr. Sandy Willis, and she basically just wanted to update people and say that they continue to oppose a mid-level practitioner, and they are working to spread awareness concerning the dangers of an insufficiently trained practitioner, which is the concern across the board, I think, with everyone, is that this position or that this program that CSU is offering is not going to result in sufficiently trained practitioners. So basically, they're just saying, again, we don't agree with this. The AVMA does not stand by it. And so I don't know if that continues to be a barrier for this position becoming a real thing, but certainly if the AVMA doesn't stand by it, that's a concern. So
I also think that they are like the ones that would say like, yes, these people can practice medicine or not. Like I feel like them disagreeing with it definitely tells me that that's not going to be a thing.
Yeah, which is good news. I don't agree with it, and I think they are wanting to. In the article, it also said that they want to promote veterinary technicians in practice. They want to spread awareness about veterinary technicians and what they actually do in a practice, and want to make it so that if we're going to add another person in the clinic, that a different position in the clinic, it should be the technicians getting promoted and having the ability to do that. So I love that they're stating that and they're making that known. So I love
Which is
that.
honestly amazing because like that's literally what we talked about on our episode.
I
So
know.
clearly we're
I
not
know.
alone in this thought.
Yeah, thank God. Thank God, because I mean, it definitely is a scary thing. And of course, we've had this conversation on this podcast before, but I do think that technicians are underutilized and underappreciated. So it would be awesome if they actually did put some focus and emphasis on giving them
Not to mention
another.
underpaid.
Yeah, heard. But yeah, that's all I had for our little news segment. So just brief updates, brief things. If you happen to know more about the NAVLE situation, please message us or comment on our videos and let us know. I'd be interested to know if you know more about it, and then I'm sure people listening would be interested to know more about it. So don't be shy and let us know.
I'd also love to hear from maybe a veterinarian who has sat for the NAVLE and write about
Yeah,
their experience and what they think should be improved based upon their experience of taking the
yeah,
test, or how it could
yeah.
be bettered to, because I do think that like a written or multiple choice exam is a really poor way to evaluate somebody's ability to practice medicine.
That's valid.
Um, but that's just me.
That's fair. But yeah, it would be interesting to hear from someone who's taken the exam, especially someone who's taken the exam recently. So if you're like a recent graduate or someone who's passed it recently, it would be interesting to hear your experience. I've definitely known people as well who've taken this exam multiple times, so I wonder what their experience is too, if they like struggle to pass it, and why. Because I'm sure you're not the only one, and it sounds like there's obviously some issues with the exam or they wouldn't be having this audit. So
Yeah. I actually also wanted to talk a little bit based on the NAVLE stuff. At my current practice, we have a veterinary surgeon who recently finished residency and is currently like on a leave of absence essentially for a few months while she studies for boards, because she's going to sit for her boards for being a board certified surgeon. And I found out
crazy.
that even like her boards for a surgery like specialty is also an exam, like a written multiple choice type of exam.
Mm-hmm.
And to me, that's just wild. Like I kind of understand the NAVLE being multiple choice over like a specialist boards, but especially for like a surgeon, I feel like it would be more practical examination if you're trying to evaluate somebody's surgical skill.
That is fair. I think with the NAVLE too, though, they do have a lot of like scenario-based questions. So it's like you get the history or the signalment of a patient, and they present to you this way or that way, and then you have to think logically about like what would be like a differential diagnosis, or what would be the most likely diagnosis, or what disease causes these symptoms. And so like, yes, it's multiple choice, but I do think there's some like,
Critical thinking that's involved.
yeah, there's not just like, what's the definition of this word? Like, you know what I mean? There is like more advanced stuff in there, but um I don't know anything about that. So, I mean, I could understand from a surgery perspective wanting to make sure that, like you said, they're properly practicing surgery. Like, but I don't know. I don't know how you would test for that other than like having someone come watch you perform surgery, right? And then like how would they accomplish that really? I think I think if you made it into a residency and you've completed it and you pass the boards, you know what you're doing.
Yeah,
So,
that's fair.
yeah. Yeah.
I guess your practical exam is your residency, really.
Yeah. Yeah.
I don't know. It's still kind of shocking to me.
Yeah. No, it is weird how they do all of this stuff for sure. How they decide. I mean, even when it comes down to like getting into vet school, like them deciding who gets into vet school is such a like, and every single school is different and they all have different
Mm-hmm.
expectations. And so it's like, I mean, I've known people who I think are like some of the smartest people I've ever met, right? Who just cannot get accepted to vet school. And it's mind-boggling to me. I'm like, this person would not only do great, they would excel in vet school, and they cannot get accepted. So it's like, I don't know. It's a strange process for sure. The whole
But
thing is strange.
we as like a community understand that standardized testing and all of that stuff is outdated and needs to change, but it's just a matter of how is that going to change.
Yeah, but as far as like the topics we're going to talk about today, I am going to talk about sun exposure in animals. I just feel like it's something that's very rarely talked about. We talk about it all the time for ourselves, but not necessarily for our pets, and it is important to be aware of. And then Justin's going to talk about veterinary AI, and how that's kind of impacting the veterinary field. So I think I'll let you get started because I feel like I've been yapping a lot. So let's hear
Okay.
it.
So I wanted to talk about just artificial intelligence in veterinary medicine as a whole. As we all know, AI is kind of like quote unquote overtaking the world, I guess, right now. It's becoming a really heavy topic, and it's kind of just on this huge rise over the last, I don't know, year maybe. I feel like it's moving
Yeah.
really quickly, and it's
Yeah.
changing the way that we function as like a world, honestly. Like I'm sure there's every individual who currently uses technology has used some sort of AI software or some sort of AI program, just to like do tasks. It's getting put into all of our devices, and big name like companies like Google are coming out with AI programs that run on their, like, we're using it without even knowing we're using it sometimes.
For sure.
And I know it's kind of a hot debate on whether AI is good or bad or whatever your feelings may be. Like ultimately it's happening,
Mm-hmm.
and I feel like there's not a lot we can do to change that. So sometimes you just have to like embrace the change, and also like look at the positive side and see like what is it doing that's like improving our quality of life and like the ability to be the best that we can be, I guess. As far as AI in the veterinary field, ultimately I think the only real function in veterinary medicine that I've seen it used is with like medical records. I think it's a pretty large thing that veterinarians are using nowadays. Like at my clinic, our clinic does pay for um, like a specific program called VetRec, that our doctors have access to, and essentially they can like have this app on their phone that they can bring into the exam room, and it records the conversation that they have with the owners, and they can speak into it like their exam findings, etc. And I have noticed like a lot of the doctors love the program that I've worked with. And the things that they've mentioned about it is their records are a lot more thorough because they're able to record things in the moment. So it picks up and like writes about things that maybe you in 12 hours after working 12 hour long shift and being crazy busy would maybe forget you talked to the owner about, or you would forget some minor exam finding that maybe isn't as prominent or isn't related to the issue of why they're being seen today. So it is, I think, helping with the doctors. Not only are they staying late less often because they're not staying late writing records, but the records are more thorough, and these softwares are only getting better. So
Yeah.
I don't know if you guys used any kind of AI software at your previous clinic, but
We did not, but we had scribes for the doctors that would follow them around everywhere. So they did have someone writing the records and listening to history and exam and all of that. So it was being done by scribes, and then doctors would like review it and go over it and make sure everything was added correctly. So I think um, it was helpful in kind of the same way as the program,
okay.
I would say. Yeah.
And I've had some minor experience using it because we do have like a triage position essentially at my clinic. So we have a specific individual who's scheduled strictly for triage their whole shift, and they have their own separate room It's not an exam room per se. It's just a room that has like a seat for the owners to sit on, a little desk with a computer on it, and you pretty much like bring owners and pets into this small room, talk to them, get a history, obtain vitals, and then you guys like split ways essentially from there.
Kinda
And
nice,
so
though.
yeah, it's a nice process. I always thought it was kind of strange initially when I started there because that's just like not what I'm used to.
I
But
feel like that's how
it
they do
has,
it, like, in human medicine, though.
yeah, yeah.
Yeah.
Typically, there's like a triage room where the nurse goes over like history in this room with the person.
Yeah.
But they have VetRec downloaded on that computer, so when I do obtain histories, I typically will use it, and I think it's nice because one, I'm able to focus way more on the owner. I can make eye contact the whole conversation. I'm not worried about like, oh my gosh, I need to type while you're talking to me because I'm over here, like, I don't want to forget what you're saying, blah, blah, blah. Like, I'm
Right.
not just staring at a screen typing while they're talking to me. Like, I can physically interact with them a little bit more.
Yeah, that's kinda nice.
So I think that's also a pretty positive part of using that software. But I also think my triage notes are way more thorough as well.
Yeah. I mean, I could totally see that. I can see the positives of it for sure. I think as a person who has worked with a lot of scribes and just, like, seeing how, like, amazing they are because they can do more than just write records for the doctors. They can print out those discharges, they can finalize invoices for them because they know exactly what's happened throughout the entire visit. It like takes off more than just record writing for them. So I'm a big like I think having scribes is wonderful and like I don't know. There's this whole debate where it's like we had the same problem when they made those self checkouts at the grocery store. It was like you're taking away a job from somebody who could have this position, right? And it's kind of the same thing now, but like with AI, where you're like taking away from this position that would otherwise exist and just replacing it with AI. And that isn't to say that it won't work or it won't be helpful or it won't streamline the process, because it's definitely possible that it will and that it does. I think it's just like that whole trying to like balance, I guess. Like, is this morally a good thing? Hard to say.
Well, I see what you're saying and I hear you, but
Mm-hmm.
most clinics don't have that though. Like scribes are not a common practice to have in a veterinary setting. So
And again, though, I think that's just because they don't want to pay for another position.
yeah,
And
that's very
instead
true.
they're paying for an AI software.
Yeah, no, that's fair.
Yeah. Which I mean, again, like you said, scribes aren't like super popular in veterinary medicine. I know they're super popular in human medicine, although probably less so now with AI. But I do think too, having medical scribes is also a great way for people who are interested in the field or have, minimal amounts of experience in medicine. They can gain more experience that way and learn a lot by doing scribing. And I actually go to school with a lot of students who did scribing before vet school, and they learned a ton from it, like a ton. Far more than you'd think. Just from listening to the doctors talk all day and writing their records for them, they learn a lot from it. And so I think it's kind of important in that regard too. But that would really be my only like issue, I guess, with the veterinary softwares that they're coming out with. Is just that like I don't want it to take away learning either from future students.
Yeah, no, I get that. I do think that like clinics who don't typically have scribes, I just question like where is that money coming from, I guess. Like is that taking away from technician pay or is that adding on to clients' bill? Like how does that
Like if
change
they
either
have
how much our
scribes.
care costs? Yeah, like how much does that either change how much care costs or take away from the amount of technicians and things like that you have available to you or like the pay that they are receiving? Because like from like a corporate standpoint, that's like how they look at it. So definitely something to
That's
think about.
fair. It's a double-edged sword. It's like you either
It is.
pay for a veterinary software that's going to end up costing clients more or taking away from technician pay, or you pay a scribe. So it's like, I don't know how much these like softwares cost, but I'm sure they're not free. I'm
Oh yeah,
positive
no,
they're not
but
free.
I'm sure they definitely probably are more cost effective than paying one scribe per doctor you have on staff, etc. Like a
Mhm.
hourly livable wage.
Mhm.
Also,
For sure.
for a facility that's like run 24/7, there are going to be doctors who are affected by the ability to use a scribe. Like an overnight doctor is not going to have a scribe. That's just not going to happen.
Yeah. Yeah.
You know?
Yeah. No, that's totally fair. Yeah.
So many aspects to this that
I know. There's also the environmental problem, which has been in the news a lot recently, but it's been a problem the entire time AI has existed, and that's just that it
you know
takes a
it's a
shit ton
very
of water, a shit ton of electricity. It is
it's a
not
heavy
environmentally
resource
friendly
sucker.
at
Yeah.
all. So a lot of cities, in fact, Tucson and I think Glendale, I could be wrong. It's one of those smaller cities in Phoenix over there, though. Glendale or Sun City, something like that. They had a ton of people sign petitions and like show up to protest because they were going to build some AI facilities here, and it worked. They did not build the facilities here because so many people were outraged, which is good because Arizona has no water, y'all. We have no water as it is. We cannot have an AI facility here. I hate to say. Like, we can't do it.
We're
So,
already in a constant state of drought as it is. And like
yeah,
Utah's the same way. We are always in a state of drought. Like
yeah,
we have no water.
yeah. I'm like, the water thing is actually like an issue. We have to be aware of that. We live in the middle of the desert.
Yeah.
Like, so
We
like,
need to be
good on
placing
everyone
these
for like,
facilities in places that like it makes sense. Like places that
yeah,
do
for
have
sure,
the available resources to be able to
to
kind of
run it.
support
Yeah.
that kind of facility.
Yeah. I don't know. It's really tough. I wish I could say that I never use AI, but I do use it for school, because they make wonderful like study guides and flashcards for me automatically, and like it's easy. I could make those things by myself, but it's just like the ease of it, when I'm busy and I have a million things to do. Oh, my flashcards are made for me. I can just click through and like learn the stuff that I need to learn without like having to spend 3 hours writing out flashcards or making them on Anki.
When you
So,
said that's like, isn't that included in like the note taking app that you use? It's like a feature in
um,
your note taking app for your iPad or something.
yeah, so I use Notability, and they can make, based off of the notes that I write out, they can make multiple choice like questions for me, like a little quiz to test me on the information. You can do flashcards. They have like a mix and match thing now, which I'm not like a huge fan of. But yeah, they basically like it goes through your notes and it creates a study guide and it creates all these things. I also use Notebook LM, which is created by Google, and I can put in basically an entire textbook chapter in there. I can put in other links, I can put in educational videos, like whatever is being given to me, I can put in there. And what it does is it pulls directly from the information that I give it. So it's not pulling from the internet, it's not pulling from random sources. The information that it's giving me is correct. It's what I'm supposed to be learning. And it will make exams for you. It will make flashcards for you. It makes a podcast for you, which sounds strangely real when you listen to it, but it will make like a 15-minute podcast off of this like huge amount of information that I'm supposed to be learning. And I would listen to the podcast on the way to school, like to study. So I could listen
See,
to like a quick recap of the information, and it would be like captivating because it's like in a podcast format.
yeah.
So it's very helpful for studying. I like it because it will even create videos for you. Like it will take all the information you give it, all the sources you give it, it will create a video that's like, again, an educational like learning video on the information you gave it. And so I've used it. I've definitely used it because it's very helpful.
But that's like another kind of scenario where it's like you're almost using it without even knowing it because it's
Mm.
so readily available at this point, and like every app and every software has added it and integrated it into their software to a point where we almost, I mean, Siri at this point is being run off of AI now. They're integrating ChatGPT into Siri. So eventually we're all going to be using it when we talk to Siri.
Yeah. It is crazy. I think the only thing that really bothers me about AI as of right now is the environmental impact. Like I feel bad using it for that reason. Like I do care about the environment. I do care about wildlife. I care about people, and it does use a lot of resources, water specifically. That's really the only thing that I don't like about it. I don't know if there's a way for them to like improve that. But again, it's just like with our cars, right? Like if it's successful right now, they're not going to change anything, and that's just how businesses work, I feel like. So,
Yeah. Whatever makes them
yeah.
more a dollar is what really matters to them.
Yeah.
Yeah. I feel like there's got to be, it's going to improve, I'm sure, and like be less of an impact on our environment. Like I feel like that's got to be something that they're going to have to prioritize eventually.
Yeah. I mean, I think the fact that people are protesting and they are stopping some of these facilities from getting built is saying something, and hopefully they're recognizing that. Either they're gonna like get to a point where they don't care anymore and they're gonna do it regardless, or they will make changes so that they can get those facilities built.
But that's all I really had to talk about AI and how it affects the veterinary profession. I am curious to see, um, you know, what potential applications could be used from AI to make veterinary practice better, aside from just like a software to write medical records. But I guess that's something that we will see in the future.
Well, one thing I can add to this before we end this little bit is that they're using AI also for reading slides like cytologies and things like that. They're using AI now. So I know you can like send in like images of microscope slides and it will be read by AI.
That I don't like. I'm not going to lie.
Yeah.
That bothers me because that takes away from pathologists' like
Yeah.
work.
So I think the idea behind it was it would take away or it would alleviate some of what technicians have to do on the floor. So like you could put like an ear swab in there, or you could
Well, I
put
see.
like, I don't know, whatever. And it would tell you like, yeah, there's bacteria or there's not bacteria or whatever. But it also is used for like other things like FNAs and whatever. I think at least the software that I've used for it, you would send it to the software, it would read it and give you a report. And if there was any confusion whatsoever, you could then send it to a pathologist that also worked for that company. So like you still had the ability to have an actual pathologist read it. But yeah, the only thing I think is nice about that is that sometimes it can be really difficult to identify specific cells, with the naked eye. And there is a chance that AI could be a lot better at that, because there are some,
Picking up
certain
on those
cell
certain
types that
things. Yeah.
look, very similar and we can misdiagnose. And I feel like AI could potentially be better at that. But I don't know. We'll see. I'm sure it could also make mistakes. So hard to say.
Oh yeah, for sure. I mean, it is. I mean, technology is less prone to mistakes than humans in general, just because it is like a programmed thing. But that's always still a risk that's involved. I think it could also just streamline the work for the pathologist too.
Mm,
Ultimately, I feel like
that's true.
people are so scared that AI is going to take over jobs, but I think the main focus, at least right now, is like how can it streamline what our job is? Like
Yeah.
how can we use it to help us fulfill our job roles, and not necessarily how can we use it to get rid of people, you know?
Yeah. Yeah. No, and that's totally fair. And I think that's, especially in medicine, that's amazing, right? Because we want to be able to get to a diagnosis faster. Always. We always want that. And even in human medicine, if they're utilizing it and they're pairing it with an actual, practitioner, I think the two together could be really
Official.
great. Yeah. Yeah. So who
Period.
knows? All right. So the next thing that we wanted to talk about is sun exposure for our animals. It seems like such a simple thing, but dogs can get skin cancers and have all sorts of issues secondary to excessive sun exposure, just like we can. So I thought it would be something interesting to talk about, both from like a clinical perspective and also from the perspective of just being a pet owner. But
This man right here,
obviously,
actually, this cat, he has effects of sun exposure on his eyeball.
oh my God, yes, you should tell us about it.
He's a perfect example.
Great.
So he has, it's like a melanoma of the eye. Well, and it's not currently actually a melanoma. I think it's called feline diffuse iris melanoma is what it's called.
Yeah.
And he has what is kind of like suspected to be the start of diffuse iris melanoma on his right eyeball. It started out as like a very small brown spot that I noticed. Well, actually, a doctor noticed that was hanging out at my house, saw it. So I sent it to my ophthalmologist friend, and she was like, "Oh yeah, let's get him checked out and get it looked at." And turns out like he's at a high risk of this dark spot on his iris developing into melanoma eventually and like taking over his whole eyeball. Fortunately, this specific cancer, it's very curable. Like eventually I will have to remove his eye, but it does not, it metastasizes really late into its development, I guess. So like if it starts to become really present in his eyeball or starts to take over his eye, the risk of it metastasizing around in his body is like very slim. So I could just remove the eye and like that would cure him of the melanoma essentially. Yeah. But just like an interesting aspect of sun exposure and how that can affect your cat's eyeballs. And
yeah, and is he like the type of cat that sits in the window all the time?
Yes, when we lived in Arizona, like he sat in the windowsill constantly right behind our couch. Like he would just post up on the windowsill and he would sit there for hours. So like he has had a lot of exposure in his eyeball to the sun, and so just something to think about. It's an interesting little tidbit.
Yeah. For sure. And that's exactly like why I wanted to bring it up, because I think it's something that people don't really think about very much. Even like in the veterinary field, I think it's not something that we like automatically think of. And like chronic sun exposure can cause all kinds of issues. Just like with us, they can get, the sunburn, they can get blisters, they can get all sorts of just obvious issues before it turns into cancer. They can get like thickening of the skin, like that leather skin, just like we can see in people sometimes where they get that leathery skin. It can cause hyperpigmentation, all sorts of things. And so it can even look sometimes very similar to other skin issues like Demodex. It can look very similar on a dog's face, especially because it tends to affect areas around the eye and the nose, which is also the same area that you would probably see Demodex on a dog, because those are areas that are hairless or have no hair. So they're more likely to be damaged by the sun. It can also look like a bacterial infection sometimes, where we don't realize that it's just never going away because it's directly related to the dog being out in the sun all the time. Obviously, dogs that are all white, cats that are all white, horses that are all white tend to be at higher risk. Again, just because they don't have the coverage that you would normally have if you have darker hair covering the skin. And then obviously, like you said, your cat has that issue with the eye. That's an area that's not protected or covered from the sun. So it's definitely an area that's vulnerable. Horses tend to get melanoma. Don't they get melanoma like right at the base of their tail and like around their rectum?
Around their nostrils too, like they're like right where their nose is. I will say that like there is like you said, white dogs and stuff like that, and light colored cats and dogs are more prone to that. Because I think there was research saying that like the less melanin that they have, like the less pigmentation, you're at a higher risk of having that cancer or having melanoma.
Yeah, for sure. So, yeah, lighter haired or lighter colored pets in just areas that are hairless or have no hair regularly. And one thing we see a lot with like pit bulls or short haired dogs is when they go outside to sunbathe, they'll actually roll onto their back. And so they usually get those spots on their stomach and in their inguinal area because, again, it's just an area that has no hair coverage. So it's directly exposed to the sun, and unless you're putting sunblock on your dog every time it goes outside, in those areas, it's just not being protected in any way. I would say the most common types of like cancers related to sun exposure in dogs and cats would be the squamous cell carcinoma. I think that's number one. They can get hemangiomas too, which are those little, they're like the red bumps, right? They almost look blood-filled,
Mhm.
but they're not, which we see a ton in, again, those short-haired dogs, like pit bulls that lay out in the sun, and they usually get that like in their inguinal area. There is like a form of hemangiosarcoma as well that they can get in the skin secondary to that. So there's a ton. Obviously, melanoma is one. Melanoma is a lot less common though in dogs and cats, so it's not one that we typically see. And from what I have been told, melanoma is far more treatable and less likely to spread in dogs and cats than it would be in people. So like for people, that's like a big deal if you get diagnosed with melanoma because it can spread very easily, but I don't think it metastasizes like that in dogs and cats, or at least that's what I've been told. So, but yeah, it can even cause, I think something that people don't really think about too is excessive sun exposure like that can potentially cause immunosuppression, because there are a lot of immune cells that live in the skin too. And if you are constantly being exposed to UV radiation in a certain area, it can damage those cells, which obviously can either lead to cancer or those cells just get permanently damaged. And so they don't have um, that barrier there that they would normally have to protect from infection and things like that. It just disrupts the skin barrier. So, all good things to think about. I think, being from Arizona, my animals never went outside too much because it's just so hot. But that doesn't mean that they weren't at risk for it. My cat loves to sit in the window as well. And so even though she's an indoor only cat, she is exposed to the sun all the time because she sits in that window. And so it's just little things to watch for. If you have a pet that goes outside and sunbathes, or maybe you have a client that keeps coming in and they have like these weird skin lesions, ask a little bit more about like what the dog does during the day. Is it sitting outside all day? Is it exposed to the sun all day? Is this related to sun exposure? Because there are a lot of things that can be related to that. Yeah, it's just something I wanted to bring up because I don't think it's thought about very much. There are sunscreens available for dogs that you can buy now. So if you do have a dog that sunbathes or goes outside frequently or just has hairless areas, you can also apply sunscreen to those areas, to just help protect them. So if you know you're going to be outside all day with your dog and they have those exposed areas, you could certainly put a little sunblock on there. It's not going to hurt anything. Or you could make sure they're in the shade or limit their exposure outside.
Because there are other issues aside from just melanoma and skin issues that are associated with sun exposure.
Yeah, for
Especially if you
sure.
live somewhere hot or you
Yes.
have a brachycephalic breed.
The other thing too that's important to remember, especially if you have a pet that goes outside all the time, is that there are certain drugs and medications that can make them more sensitive to the sun and UV rays, and so they can become more likely to get secondary lesions from the sun because they're on a specific medication. I think it's pretty rare with like medications that we would send home with pets, but certain toxins too, like if they eat certain plants, can cause that like photosensitization where they just become extremely vulnerable to sunlight. Yeah, so keep your pets inside and put on sunscreen for your pets the same way you would.
And your pets with blue eyes are also at a higher risk.
That is true. My dog had blue eyes and I wasn't always great about it, but she did have sunglasses that she would wear if we were going to be outside all day, especially if we were around water, because the light rays would reflect off the water and she like straight up couldn't see. So she wore sunglasses.
Yeah, but that was for more than just her blue eyes.
Yeah, but if you do have blue eyes, even if you have normal vision and normal functioning eyes, I guess, like if you have blue eyes, you are more sensitive to that light. So,
Me and you get it.
yeah, exactly. I got to wear sunglasses
Blue-eyed
everywhere I go.
queens over here.
I cannot see anything if I don't have my sunglasses. So, but yeah, they do make sunglasses for dogs. They look like goggles.
They're called Rex
Specs
Specs.
is the
They're
yeah,
amazing.
that's the brand that I would use. They're great. They fit super well on their face. It's definitely designed for dogs, and you have to measure the muzzle and like around the neck, I think. And they'll send you like an
like
exact
to
measurement.
properly fit them.
Mm-hmm. Yeah.
Yeah,
So,
my
and they have clear lenses, they have dark lenses, they have like anti-reflective lenses, they have all sorts of things. So, depending on what you need it for. My dog just, her pupils did not like dilate and constrict the way they were supposed to. And so if she was in really bright light, like she straight up could not see, and it was damaging to her eyes. So she had the sunglasses for that.
but they definitely are ophthalmologist recommended because the ophthalmology department at my hospital does sell them to clients.
Yeah. No, they're great. It was super easy, I feel like, to train my dog to use them too. Like she took to them really well, and I think again it was because they fit her super well, so we didn't
Comfortable.
really have any issues. Yeah. Yeah.
Well,
So
I feel like she probably noticed like the positive impact it had on her vision too, like for her specifically, because she probably could see better with them on, like outside
yeah.
in general. So she
Yeah.
probably enjoyed wearing them for that reason, even.
Yeah. That, and it was always like it was a positive thing. If she had the sunglasses on, she knew we were going somewhere and we were doing something fun outside because the
Mm.
sunglasses are on. So she was like, "We're going out. I'm
She's
fine
like,
with
we're going
this."
on a hike or we're going to a lake. We're doing something real fun today.
Yeah. So she was always down for that. But yeah, super easy to train. They gave me like a training guide with them when I ordered them online that like helped me train her to wear them. So I think if you follow the instructions, it worked well for me. And they make so many different like things for pets now. They have jackets and clothes and like,
Oh, I know.
you can cover your pet from the sun definitely if you have to.
Yes, it's all very readily available. And um, for anybody who doesn't know, Roughwear is great and does offer veterinary professionals a very decent discount on all of their products. If you didn't know that and you like to use Roughwear products and you're a veterinary worker, I highly recommend signing up for their veterinary professional discount program because their shit's expensive, low key. So
Yeah.
definitely 10 out of 10 recommend.
Yeah, good
We
tip.
gotta take advantage of what we can, you know?
That's so fair. That is so fair.
It's like the only reason that we have a litter robot is because of the discount that I was provided for being a veterinary professional.
Yeah, it's tough out here in the veterinary world.
Some of the
We
shit's
don't make a lot of
expensive as
money
fuck.
despite what people think. So, um yeah, it's definitely helpful. We're out here helping animals. The least they could do is make
Let's help
owning
us
animals
that
for us a little bit better.
for real. I will say we do get a lot of great discount stuff for animal products and stuff, so I'm glad we are recognized for those things.
Yeah, for sure.
So take advantage of what you can as a veterinary professional because, we're taking advantage every day.
That is true.
40 hours a week, if not more.
Well, I think that's all we had for today. But yeah, I feel like these were good discussions. If you guys have anything to add to them, or if you've seen any cool cases related to sun exposure, please send those to us so we can talk about them. We would love to hear more from our listeners. So please engage.
Please engage.
I'm gonna say it every time.
Yes. Until we get something, we're going to say that. So if you want us to shut up, just send us an
Yeah.
email. Do you have a chaos corner this week? Because I have a good one.
Oh, you do? Let's hear it. I
No.
don't have one.
No? Okay. Well, I'm going to talk about my chaos corner because, God, I am. It was a breeder, we'll say, with quotes, that brought in their golden retriever puppy to my work. This golden retriever puppy was thought to be a transfer from like an urgent care in the area. The pet, we found out later, had never even been seen by the urgent care, so I don't know if the urgent care just like got their call and said, based on what you're telling me, you should go here instead, or what the situation was. But this golden retriever puppy came in, and it was real rough. This like golden retriever puppy, it was still like a golden, so it was sweet and nice and like wanted attention. But like goldens and labs, like that's not a good indication of their status of health, because I've literally had labs with giant hebo abdomens and have a PCV of like 12% that like wag their tail and want attention from you. That's just like,
that's true.
They just be like that,
Yeah.
But this puppy was pretty dehydrated, like very dry. I don't know if that term makes sense, but like if you know, he's just dry. Like you just like tinted her skin and it just like stayed put. She had ocular and nasal discharge. For a second, like my mind was going like, does this thing have distemper? It came from the breeder moved here from Tennessee or something, somewhere on the East Coast. So there's like question of other kinds of diseases that maybe we don't see as often, such as distemper and things like that. But the puppy came in with like a peripheral IV catheter in, and we're like, where did this catheter come from if you transferred from an urgent care that never saw you? Where do you think it came from? I want to actually hear your thoughts.
Is the owner a nurse?
Not to our knowledge.
My cat just attacked me. Are you good? Jesus.
She's feeling feisty. Remember when she said that her cat's a bitch? There it is.
There it is. I wasn't giving her enough attention, I guess. Hey, get out of there.
She's gonna drink your matcha.
Yeah, my guess would be like a human nurse.
Nope. They do not have any medical background to our knowledge, but the owners did place this catheter into the dog. It was a 24 gauge IV catheter.
Where did they get the supplies?
Apparently you can buy catheters on Amazon.
So they just ordered an IV on Amazon.
Well, listen, not only did they place an IV catheter, they're also giving this dog IV fluids at home. They also parvo tested this dog at home. Yeah.
How did they do that?
I don't know where they got the parvo test. They also started this puppy on Clavamox. All at home.
Shut up.
No, I swear to God.
What?
The IV catheter, yes, you can order them on Amazon. We did like look that up to see if that was a possibility. I never looked up whether or not you can order IV fluids on Amazon, but initially my mind was like,
I'm sure you can order fluids.
If they're giving this dog tap water in its vein, I'm gonna lose my shit. Let's see. Sodium chloride. Let's look it up. Okay, so you can order like, I'm not seeing any like IV fluid bags on Amazon, but you can buy like bottles of saline.
That's wild.
Like
but
the
that
bottles
makes you
you'd
wonder
use
what
to
they
like
were
flush
actually.
an abdomen.
You know
or
where you
whatever.
can order fluids from? You know where you can order fluids from is Chewy. I know that you can order bags of fluids from Chewy.
Really? Like without a prescription
Yes.
though?
I don't think it requires a prescription.
Let's see. I'm gonna look. We'll look up LRS on.
So how did they
Chewy.com.
just like watch a YouTube video on how to place an IV on an animal and then they did it?
I don't fucking know, man. They didn't like tell us all that information. And
Oh, I would have been asking.
Okay.
I would have been like, where did you get? I need to know like where you got this information. Where did you get the Clavamox from? Where did you get this information from? Like how much fluids were you
they
giving?
were trying to like clearly they were getting supplies from somebody who had access to them, and I think they were trying to cover this person's butt. You can buy fluids on Chewy, but it is a prescription item.
It is, okay. That's scary though. I
But
mean, giving fluids is not a benign thing. And if you don't know what the underlying cause of your pet's issues are, you could kill them by giving them fluids. And that seems like such a simple, easy thing to do, but you could absolutely kill your pet. Absolutely, you could kill your pet. And
also,
easily, honestly, easily.
yes, especially a puppy.
Oh, yeah. Yeah, there is
Like
a
a
such thing as
60-pound
fluid
dog,
overload.
and you give like a liter of fluids to like an otherwise healthy, like large dog. Yeah, you're probably not going to have any bad negative side effects, but a 8-pound puppy, oh yeah, you could easily fluid overload that patient. You could easily like throw off their electrolytes, and electrolyte abnormalities can be life-threatening. For those of you who don't know, it's a very serious thing. Also, speaking of at-home treatments, I saw this video on my social media the other day. I think it was yesterday. A veterinarian who was speaking out about this like video that was posted by an owner of like activated charcoal gel that the owner ordered online and was told by some other pet owner
Mhm,
that they should have this on hand in case their pet gets into some sort of toxin. And
mhm.
she just posts
It's
a
very
video of her
popular.
force
I've seen
feeding.
so many ads.
Yeah, that is also not a benign treatment. Um, and she's like, please don't ever do this, because it was just a video of the dog and the owner like force feeding their dog this gel, which for those of you who don't know, that can also throw off electrolytes. It can cause hypernatremia, which can be life-threatening and very serious.
Mhm.
And so also 10 out of 10 do not recommend. Just
Yeah.
don't break the law, first of all, because technically you're practicing medicine without a license, so that's illegal in and of
Mhm.
itself. Um, but also don't put your animal at further risk by doing something that you think is right, when ultimately
Yeah.
you could be threatening your animal's life more than whatever they got into.
Yeah. This like brings
Also,
up a whole nother like slew of issues that I would just love to talk about.
yeah,
Like
maybe next
our
episode.
next
Now we have
episode
new hot
has to be about
topics.
this.
Yeah.
Yeah,
When I bet you anything,
because
there's
this is
a
insane.
great Reddit thread of like horror stories of owners like practicing medicine at home.
Well, the other thing too is you told me that they gave this dog Clavamox, which we don't know where the Clavamox came from. Presumably, it was not prescribed by a doctor. And even if it was a technician that got a hold of it, giving antibiotics, especially to a puppy, when you don't know whether or not they need the antibiotics or whether or not that is
Or
the
the dosing.
correct antibiotic to treat their condition, right? Um, that's not even empirical treatment at that point. That's just throwing something at it and hoping it works. And
Which we
in
can
a
have a
young
whole separate
puppy who
conversation just about
already doesn't,
antibiotics.
oh my God, we should. Throwing antibiotics at a young puppy who doesn't have like a fully developed immune system, who doesn't have a fully developed GI flora. I mean, there's so many things that are wrong with that that just drive me crazy. And if the dog genuinely needed the antibiotics, that is one thing. But if it didn't, or we don't know that it does without other testing, just throwing a random antibiotic at it is not the answer and can do more harm than good. And I think
Mm-hmm.
people just think that antibiotics are this like miracle thing and that it doesn't matter what antibiotic you use, it will fix whatever infection is going on. And that is absolutely not true. Um, this goes back to our science literacy conversation, where it's like people just do not understand basic things. Like,
Basic anything.
and I'm not expecting everybody to know that, but if you don't know, don't just
Don't act
attempt
like
it
you do.
yourself.
Yeah.
Like this, yeah. And don't just randomly Google it because Google is not going to give you. Anyway, I digress.
That's a whole nother
These are my
soapbox.
pet peeves. Yeah. These are my veterinary
I think
pet
we should
peeves.
talk about this more on our next episode, because I think this would be a good topic.
We should, because I have like a million things in my head right now. But this was a good chaos corner. That is definitely crazy.
It was insane. It was insane.
Did you
But
find out
I
what's wrong
honestly
with the
was like,
dog?
oh my god. I think we sent out a lepto. The critical wanted a lepto titer on the dog, and I never heard, or I don't really know what the result was, because I don't check my work software on my days off anymore, nor do I look into old patients anymore, because I'm trying to have boundaries.
You know, that's so fair.
Look at me. Such an improvement.
I know. That's good, though. That's good.
I couldn't have said that 6 months ago, even.
I know. I'm proud of you.
It's not that I don't care. It's that I'm putting myself first.
Of course. Yeah.
That was me pretending to cry,
As
by
you
the way,
should.
for our viewers.
I think that was obvious.
Okay. I don't know, man. But if you don't have a chaos corner this week, I guess that's kind of a wrap, you know?
That's kind of it, yeah. My chaos corner was reacting to your chaos corner. Hearing that story was mine. Well, as always, take care of yourselves the same way you would take care of your patients. And we will see you next time, hopefully for a very interesting discussion.
Yes, absolutely. Love you guys.
Bye.